Insulin is a basic and a fundamental human right to a diabetic person. Because everybody has right to what? Right to life. So if Insulin for Life is giving me insulin, then come on. They are obviously giving me my basic right to live.
It's not a sickness that is easy.
If we don't have test strips, it's like shooting in the dark. If we don't have insulin, we have no help in terms of helping either. So, I think the matter of having those two things it's unthinkable not to have it.
Because without that insulin, everything goes wrong. For the type 1 diabetes, they require insulin for survival. So really, without the insulin, we will lose a lot of the children. Simply because the government only buys a little bit of mixed insulin every year, and that can't cover all the needs of the country in terms of insulin. To buy that off the shelves, out of pocket, I don't think any of my 67 children now, or 70 children, will be able to do that. None of them will be. I mean, in fact, almost all of them live below the poverty line, less than $1 a day.
So insulin is a problem in the Gambia. Test scripts is another problem. You can have a machine, but having access to test script is also another problem. And what is the use of the machine if you don't have a test script? How are you going to inject your insulin if you don't test your blood sugar?
To be able to test one blood sugar a day and be injected at least 2 times a day with insulin, to me, if that is happening, it will be a dream come true in a lifetime. Do I know a lot of people who have passed away from type 1 diabetes? Yes, I do know many of them. And at least in the last 4 years, I've known about 10 children.
Dembal follow ya soto, demba boja. Atel follow diabetes soto. Barjana ka soto. Asasa atal. Sasa ni meta. Pare untol malon ko diabetes lo.
My elder brother was first diagnosed Demba, and after that, me and Karmo also were diagnosed. Demba is my brother. He's a friendly person. Me and him, we do everything together. We eat in the same basin. We sleep in the same bed. The early day that he died, the time we are sleeping, I heard him crawling. So I wonder why. Then I opened the gate and called my dad. That's the time they take him to the hospital. And this health center referred us to Carnifing. That's the hospital he passed away.
Oka Kenya ni kuya kubalet. Ni tanu moka automobile. Tenunu nga bondi balfa. Anim ba kelan fambala. Ila jati kendi ante lafta wala.
Nobody should die because you have type 1 diabetes. What I'm saying is the access to insulin and supplies should be improved tremendously. It should be a priority for governments
We think that globally there's about 80 to 100,000 children that wake up every morning and don't know if they'll have supplies to manage their type 1 diabetes each day. So lack of access to diabetes supplies, which are essential, is not a small problem. It's huge.
The challenges are multifold. First of all, you have to be properly diagnosed. Secondly, you need to have access to a good healthcare provider. And then you need insulin available to you, and you need a way to maintain it safely and to store it and have it accessible to you at all times.
You can have 60%, even 85 or 90% of individuals, they don't have refrigeration because they don't have adequate access to power.
I have seen people digging holes on a mango tree or an orange tree and then wrapping their insulin in threads and make it wet and then bury it there. Whenever they want to inject, they go and pull because they don't have fridges at home.
That is our major problem. We have to keep them under cool temperature or whatsoever has been directed.
We put our insulin under the bowl. We put sand there after we put water.
The insulin should not be too hot, otherwise it may get spoiled. So this is the method we use so that it can be somehow cool, so that we can use it.
The day before, I was having really trouble in school. I couldn't focus. We were on the 4th floor last period and we had to go downstairs to leave, and I just couldn't walk on the stairs. I had to have my friends carry me down because I couldn't move my legs.
All right, waffle is
Not ready.
it's ready.
No.
These are my favorite waffles. Chill, will you? It's delicious now. 32 grams. And what's the formula?
Okay,
Okay.
2.9 bolus, 21.
There you go.
Yeah. We went to my doctor's office. She tested me literally for everything. And then finally she came back with the test and she's like, yeah, you need to go to the hospital right now. And she's like, your blood sugar is at 600. The doctor even said that if we had come in basically 48 hours later, I would be in a coma. My mom stayed with me in the hospital that night. My dad went to the pharmacy to pick literally everything up and bring most of the stuff to the hospital just so that we would know what to do with it.
We were coming up actually on the centennial or 100th anniversary of the identification of a way to extract insulin and provide it to individuals as a way to treat diabetes. If you actually look at the last number of years, it's been amazing the innovations that have come into the field. We have an array of tools in the United States to provide diabetes management. Now there's the story of international and the developing world. If you're in the developing world and you can get one strip a day, forget continuous glucose monitoring. If you get one strip a day, you're doing pretty good.
As you may be aware, medical costs can be astronomical. Not everyone who is living with a condition, diabetes, have access to insulin. And even for those who have access, it comes with a cost. Food is needed and syringes are needed or other medications are needed. Of course, you'll purchase the food, right? And neglect the medication. And this can pose a big challenge for our people living with diabetes.
I was diagnosed at the age of 4. So it's a very hard condition to live with.
It is very difficult to be a parent with a child who has diabetes. It definitely takes a lot out of you. At one time, DeAndre was in a coma, and it was very emotional for me because he's my only son, of course, and I'm not comfortable when he's sick. But one thing that I've always comforted myself with is that the fact that everybody has their own set of troubles, and this is just mine. Sugar is really good today.
I'm doing good.
All right, good. Nice, keep it up.
The first day we came home, the only thing that stood out to me was Nyla screaming and asking, why are we hurting her? Why do we have to keep hurting her?
Yeah, well, we'll definitely have to check at the pharmacy to get these supplies, and I'll tell you, sometimes not even the pharmacy have the type that you're looking for, and so when you do find it, it's very, very expensive.
There are varying types of syringes. Here we have the BD Ultra Fine, and these are the syringes we recommend and we give to our children living with type 1 diabetes.
The type she uses is the small one, and sometimes the pharmacy wouldn't have it. Like when she was just diagnosed, I called around, and most times they won't have the type of needle the syringes that she uses.
When I first switched over to the pump, I knew that I wanted to donate my supplies because I wasn't going to use them anymore. And so me and my mom were both looking online of where we could donate. And then we came upon Insulin for Life. We were reading through it and we were like, this is the coolest thing ever, because what really helped me through getting diagnosed was knowing that I could actually do this because I had everything to do it with. And imagine myself back at the hospital, not having the supplies and then getting them. I know how much they need it, and I know how hard it is without the supplies. And I just can't imagine what it would be like without them, so I knew that I had to give them. And I knew that it makes someone else happy to get them.
So with Insulin for Life USA, one of the things we're trying to do is bridge that gap and bring supplies in to those who simply cannot afford it, and to where government directed expenditures can't meet the needs.
We collect insulin, test strips, and diabetes supplies from all across the United States, and then we process those and connect them with healthcare providers in developing countries, currently in 12 different countries. The amazing thing is people send in what they have, and we often get asked, if I have a meter and no test strips, or I have test strips and no meter, can I still send them? And the answer is yes. It's amazing to see things come from all across the country fitting together beautifully to make one big package to send out. We make sure that we're coming alongside those healthcare providers and just supplying the tools that they need to do their job in treating patients.
But our goal is not just to keep people alive. Our goal at Insulin for Life USA is to improve lives.
Newly diagnosed diabetics and all children with type 1 diabetes get referred to this clinic by my colleagues. It's a big responsibility that we have for not only our community, but basically the entire country. The project was supposed to look after 40 children, and we are now 67. And I've been told today that 2 also have been enrolled, so we are 69. So a 40 patient project has been extended to almost double.
If we will not meet Dr. Gay, we cannot survive a lot of things here. Without Dr. Gay, we cannot survive. In fact, we cannot survive.
If I go to the clinic, I have everything. I have the machine, the sticks, and which we use for blood sugar testing, and I have all the insulin that are needed for me. Well, I didn't pay anything in the clinic. They did not demand anything from us.
You have enough needles?
Yeah.
You have enough insulin?
Yes.
Enough test strips?
Yes.
So you're good to go?
Yes.
But then you know that if you have any problems in between, you can always come back. What I'm getting is really a lifeline. I mean, a good number of the children would have died without the support we get from Insulin for Life.
Insulin for Life, this program is extremely helpful to persons here in Belize. We inform the parents that once they're diagnosed with type 1 diabetes, all the supplies that they will ever need to maintain their diabetes condition and keep it intact, we will be able to give them free of cost.
The Diabetes Association helps me because if it wasn't there, then I wouldn't get my needles, I would keep on vomiting, I would be sick, and I wouldn't have strips, I wouldn't have these testing kits, but they're a big help.
I get my supplies at the Belize Diabetes Association. Every month, we signed up and we get all our supplies. Without them, it wouldn't be possible.
I'm hopeful that the Insulin for Life program is always going to be running in the Diabetes Association because it's really helping out a lot of people right now, members of the association, to receive that caregiving from the association where their medical supplies are concerned.
What they are doing is they are saving life. One who saves life, nobody can pay that person. Yeah, so we are giving them a big thanks.
I'm very healthy now because now I can control my diet. I can know whether the sugar level is high or low. I can play football now. Yes, I can play with my friends and I can score goals also. I'm good in football.
There's a reward aspect of it which I enjoyed. I mean, I get very fulfilled when they say thank you to me every time I see them. And to me, that's the biggest pay I will ever get, and that's the pay I love most.
Really, one of the things you come to appreciate in this is that you really need the support of those institutions, the schools, the association. It's vital. If you don't have that, it's exceedingly difficult. You know, you can't be there every day. You're at work, life has to go on. And so we thought that the transition was particularly difficult, but made a lot more manageable with the assistance of the association and schools and everybody else.
Well, it makes me feel like sad about that they don't have it, but then also like really proud of everyone who donated to Insulin for Life for donating, because it's just like a really, really great cause. And I don't know about everyone else, but it just makes me proud.
I too worry that someday we won't have supplies, someday we won't be able to do this. Insulin for Life is dependent on our donors, dependent on people sending in their supplies, dependent on financial donations to make this possible. We do understand that people are counting on us, and we also keep in mind that others are working on the bigger picture issue, which is working with companies and governments to find out why is there no access, what can change to make a difference. So we see ourselves as providing a service that hopefully is temporary, meaning temporary until governments find a way to step up and make this life-saving resource available to their people.
Our hope at this time is that every child living with type 1 diabetes will have access right, that diabetes supplies will be available and accessible and affordable to them at all times. That would be our biggest hope.
I am not moving myself forward. It is insulin that is moving me, because without insulin, I am nothing. So, bravo and then congratulations to Insulin for Life for giving us a chance